Pregnancy, or gestation, is calculated as 40 weeks and starts from the first day of your last menstrual period. Pregnancy is classified into 3 stages known as trimesters. The gender and inherited characteristics of the baby are decided at the moment of conception. According to a study published in the Journal of Clinical Epidemiology, most women, 59%, experienced an onset of pregnancy symptoms by their 5th or 6th week, while 71% reported symptoms by the end of week 6 and 89% by week 8. If you don't feel any symptoms at all, don't worry. Today, we're diving into some fascinating insights about early signs of pregnancy that you might not know about. Every person and every pregnancy is different. So, if you are pregnant, you'll likely experience a unique combination of common, not so common, and sometimes overlapping symptoms, and they may show up earlier or later than expected. A pregnancy test is the only way to know for sure. But if it's too early to take a test, you may be on the lookout for early signs. Or maybe you think you're already experiencing some early pregnancy symptoms. From surprising symptoms like implantation bleeding to changes in your body's hormones, we'll be taking you through each of the 12 indicators that could hint at the exciting journey ahead. So, if you're curious about what your body might be telling you, stick around because you won't want to miss this informative video. Welcome back to our channel. If you are new in our channel, kindly don't forget to subscribe to our channel. Here are the 12 severe symptoms of pregnancy. Number 1. Spotting or light bleeding. Many women are surprised to learn that spotting or light bleeding can be an early sign of pregnancy, but about 1/3 of women experience it. This is often called implantation bleeding, because doctors believe it occurs as the fertilized egg attaches, or implants, itself into the uterine lining. This is different from bleeding that could occur from something like a miscarriage, which is usually heavier. When does implantation bleeding occur? Implantation bleeding typically occurs 10 to 14 days after conception, which is just before or right around the time your period is due. So you may think you've gotten your period, but implantation bleeding is a light flow, which may start and stop over a couple days. And while it can take on a range of colors, it's more likely to be pink, brown, or light red. Your period, on the other hand, may start off light in flow and in color, but after a couple days becomes heavier, changes to a crimson-red color, and lasts up to a week or so. Number 2. Lower abdominal pain or cramping. While cramps and lower abdominal pain can signal a coming period, they can also be a sign of egg implantation. What do implantation cramps feel like? Implantation cramps can occur with or without spotting or bleeding, and may feel different from period cramps. For example, you might feel mild to moderate prickling, pulling, or tingling that comes and goes over a few days. But menstrual cramps can often feel like a throbbing or dull ache, and typically start a day or two before your period. Number 3. Breast tenderness, swelling, or tingling. When you're pregnant, your body experiences big changes in hormones, specifically increases in estrogen and progesterone, to support your growing baby. This change in hormones can contribute to many symptoms, including breast tenderness. Oftentimes, increased breast tenderness, swelling, or tingling start to become noticeable a few days before a missed period. If you usually experience breast tenderness leading up to your period or shortly after it begins, pregnancy-related breast tenderness and swelling will likely be more intense than you're used to and stick around. You may also experience nipple soreness. Number 4. Nausea or vomiting. Morning sickness might be the most well-known of all pregnancy symptoms, taking the form of food aversion or nausea and even vomiting for some. This symptom can set in as early as 2 weeks after conception, which is around the 4th week of pregnancy, and right around the time you'd miss your period if you were pregnant. But some may not experience nausea or vomiting at all, and despite its name, morning sickness can actually happen at any time of the day or night. Number 5. Bloating or constipation. We all experience bloating or constipation from time to time, but both are quite common during pregnancy. Once again, those changing hormones are the culprit. They slow down digestion, which can cause a buildup of air in the gut and lead to constipation. Early on, bloating or constipation may be mild and accompanied with other pregnancy symptoms. But, as a heads up, if you really are pregnant, these symptoms may stick around throughout your whole pregnancy. Number 6. Mood changes. From a stressful day at work to the natural wonders of your menstrual cycle, there are a lot of things that can affect your mood. But changes in mood are very common during pregnancy, and they may be especially noticeable early on as your body gets a sudden burst of estrogen and progesterone. If you are pregnant, any mood changes you're experiencing are likely coupled with other symptoms such as fatigue or nausea. You may feel more sensitive or weepy, or perhaps your fuse is a little shorter and you're more easily annoyed. Number 7. Headaches. Headaches are a part of life. They come with colds and allergies. They come with stress or fatigue or when you cut down on caffeine to help prepare your body for pregnancy. But they can also come with pregnancy. Headaches can happen thanks to the increasing blood volume and hormonal changes that occur in early pregnancy. You can also get headaches if you're dehydrated as a result of nausea. Number 8. Nausea, morning sickness. Morning sickness is a famous symptom of pregnancy, but not every pregnant woman gets it. The exact cause of morning sickness is not known, but pregnancy hormones likely contribute to this symptom. Nausea during pregnancy may occur at any time of the day, but most commonly in the morning. Also, some women crave or can't stand certain foods when they become pregnant. That's also related to hormonal changes. The effect can be so strong that even the thought of what used to be a favorite food can turn a pregnant woman's stomach. It's possible that the nausea, cravings, and food aversions can last for the entire pregnancy. Fortunately, the symptoms lessen for many women at about the 13th or 14th week of their pregnancy. In the meantime, be sure to eat a healthy diet so that you and your developing baby get essential nutrients. You can talk to your doctor for advice on that. Number 9. Extreme swelling of your hands or face. Swelling in your hands makes it hard to bend your fingers or wear rings. Swelling in your face makes it hard to open your eyes all the way. They feel and look puffy. Your lips and mouth feel swollen, or you have a loss of feeling. This swelling is not like the usual slight swelling that most moms have during pregnancy, especially during the last few months of pregnancy. Number 10. Urge to pee or burning sensation while you urinate. If you feel an increased urge to pee, but find only a few drops come out, or if you have a burning sensation while you urinate, it may be a sign of a urinary tract infection, UTI. Other symptoms of a UTI can include fever, chills, or blood-tinged urine. Your provider will be able to diagnose your symptoms and treat the bacterial infection to avoid complications. Keep in mind that frequent urination on its own is a common pregnancy symptom during the first trimester and later on in pregnancy, as your baby grows and presses on your bladder. Number 11. Missed period. The most obvious early symptom of pregnancy, and the one that prompts most women to get a pregnancy test, is a missed period. But not all missed or delayed periods are caused by pregnancy. Also, women can experience some bleeding during pregnancy. If you are pregnant, ask your doctor what you should be aware of with bleeding. For example, when is bleeding normal and when is it a sign of an emergency? There are reasons, besides pregnancy, for missing a period. It might be that you gained or lost too much weight. Hormonal problems, fatigue, or stress are other possibilities. Some women miss their period when they stop taking birth control pills. But if a period is late and pregnancy is a possibility, you may want to get a pregnancy test. Number 12. Racing heart. It's normal for your heart to beat faster during pregnancy. In fact, your heart pumps up to 30 to 50% more blood when you're pregnant compared to when you're not pregnant. This is so that your baby receives the appropriate amount of oxygen and nutrients through the placenta. However, if you feel that your heart rate is staying elevated and/or you have shortness of breath, contact your healthcare provider right away. Thank you for watching. If you found this information about early signs of pregnancy helpful, make sure to hit that like button and subscribe for more insightful content.